Hello everybody and welcome back to Divulgando Ciencia. My name is Gustavo Harris-Huber. In this video, I'm going to talk to you about toxoplasmosis. Probably you have already heard about this disease, but I'm going to tell you here what are the risks associated with it. If you like the video, please give it a like, share, subscribe, click the notification bell, and follow me also on Facebook and Instagram. Welcome to this new video. Toxoplasmosis is a parasitic disease caused by Toxoplasma gondii. Infections with toxoplasmosis usually cause no obvious symptoms in adults. Occasionally, people may have a few weeks or months of mild flu-like illness such as muscle aches and tender lymph nodes. In a small number of people, eye problems may develop. In those with a weak immune system, severe symptoms such as seizures and poor coordination may occur. Toxoplasmosis is usually spread by eating poorly cooked food that contains cysts, exposure to infected cat feces, and from an infected mother to her baby during pregnancy. Rarely, this disease may spread by blood transfusion. It is not otherwise spread between people. The parasite is known to reproduce sexually only in the cat family. However, it can infect most types of warm-blooded animals, including humans. Diagnosis is typically by testing blood for antibodies or by testing the amniotic fluid in pregnant women for the parasite's DNA. Prevention is by properly preparing and cooking food. Treatment of healthy people is usually not needed. Up to half of the world's population is infected by toxoplasmosis, but have no symptoms. In the USA, approximately 11% of people are infected, while in some areas of the world this is more than 60%. Approximately 200,000 cases of congenital toxoplasmosis occur a year. Charles Nicolle and Louis Monceau first described the organism in 1908. In 1941, transmission during pregnancy from a mother to baby was confirmed. There is tentative evidence that infection may affect people's behavior. Pregnant women are also recommended not to clean cat litter boxes or, if they must, to wear gloves and wash their hands afterwards. During pregnancy, spiramycin or pyrimethamine sulfadiazine and folic acid may be used for treatment. Congenital toxoplasmosis is a specific form of toxoplasmosis in which an unborn fetus is infected via the placenta. Congenital toxoplasmosis is associated with fetal death and miscarriage, and in infants it is associated with hydrocephalus, cerebral calcifications, and chorioretinitis, leading to encephalopathy and possibly blindness. A positive antibody titer indicates previous exposure and immunity, and largely ensures the unborn fetus's safety. A simple blood draw at the first prenatal doctor visit can determine whether or not a woman has had previous exposure and therefore whether or not she is at risk. If a woman receives her first exposure to T. gondii while pregnant, the fetus is at particular risk. For pregnant women with negative antibody titers, indicating no previous exposure to T. gondii, serology testing, as frequent as monthly, is advisable, as treatment during pregnancy for those women exposed to T. gondii for the first time dramatically decreases the risk of passing the parasite to the fetus. Since a baby's immune system does not develop fully for the first year of life, and the resilient cysts that form throughout the body are very difficult to eradicate with antiprotozoans, an infection can be very serious in the young. Despite these risks, pregnant women are not regularly screened for toxoplasmosis in most countries, for reasons of cost-effectiveness and the high number of false positives generated. As invasive prenatal testing incurs some risk to the fetus, pregnancy losses per toxoplasmosis case prevented, postnatal or neonatal screening is preferred. The exceptions are cases where fetal abnormalities are noted, and thus screening can be targeted. Pregnant women should avoid handling raw meat, drinking raw milk, especially goat milk, and be advised to not eat raw or undercooked meat, regardless of the type. Because of the obvious relationship between toxoplasma and cats, it is also often advised to avoid exposure to cat feces and refrain from gardening. Cat feces are common in garden soil, or at least wear gloves when so engaged. Most cats are not actively shedding oocysts. since they get infected in the first 6 months of their life. When they shed oocysts for a short period of time, 1 to 2 weeks. However, these oocysts get buried in the soil, sporulate, and remain infections for periods ranging from several months to more than a year. Numerous studies have shown living in a household with a cat is not a significant risk factor for T. gondii infection, though living with several kittens has some significance. In 2006, a Czech research team discovered women with high levels of toxoplasmosis antibodies were significantly more likely to have baby boys than baby girls. In most populations, the birth rate is around 51% boys, but women infected with T. gondii had up to a 72% chance of a boy. As you could see on this video, toxoplasmosis is not a problem in immunocompetent people. However, this could be very dangerous for immunosuppressed people, pregnant women, and also babies. So it would be nice to test from time to time and also treat the disease early. If you like the video, please give it a like, share, subscribe, and follow me also on Facebook and Instagram. This would help me a lot. Thank you very much and see you next time.